Welcome back. It is 7:20. Dr. Kumar is here from Austin Gastroenterology, solving all of Catherine's cloggy problems.
It's not just her. Everybody in this town.
Hey, she's been sick for a month with this stuff. Zach had it too. The kids had it. Everybody's had it.
Yeah, you know, it's the time of year, I guess. Well,
ear infections we're talking about.
Yeah, ear infections today. You know, but I mean, the upper respiratory crud that people get, oftentimes that's how ear infections form. You know, ear infections are more common in kids.
Yeah.
In fact, Catherine was telling me about her experience.
Well, now yours is just hit 6 months.
6 months, hadn't had as yet.
Susceptible to ear infection?
It is. In fact, it's just interesting that 50% of kids will have had an ear infection in their first year of life, and by the time you're 3 years old, 80% of kids will have had an ear infection.
So it's pretty common.
Very common, particularly amongst young kids.
And painful in those little kids.
It can be. You know, that we've had a family friend whose kid was just lethargic. She was like 3 months old, 4 months old, and her only symptoms was just kind of tired and lethargic, and was, a quote, a good baby.
Yeah.
And then went to the doctor, looked in her ear, and was like rip-roaring. Says, oh my
bingo.
God. Yeah, you know, so it's not always that overt.
So they don't necessarily complain all the time.
Right. Often, you know, the reason that it's kids that get these ear infections is because of the anatomy.
Okay.
You know, your ear, you have your outer ear, your inner ear, and your middle ear, right? And there is a eustachian tube that drains the ear. It goes from the ear canal to the back of your throat, called the eustachian tube.
Okay.
And it's an open, that's how we equilibrate. That's how we let the pressure out of our inner ears. You know, and when we go up into the airplane while your ears get clogged, because these eustachian tubes close off.
I got you.
Okay. Now, in kids, these tubes are more horizontal and they're shorter, and bacteria and viruses are easier to enter through that.
Right.
And your adenoids, you know, you get your tonsils and your adenoids, which are these lymphoid tissue in the back, right back there in your throat, and that's right next to these eustachian tubes.
Okay.
So when a person gets an upper respiratory infection, kids always get upper respiratory infections. They got siblings, they're in daycare, they get these upper respiratory infections, and the viruses end up getting trapped in these adenoids, and the adenoids are right next to the eustachian tubes. They get in there, they can travel up, they get clogged, you can't drain it, you get an ear infection. That's why it's so common.
Right.
And like you said, the symptoms are not always clear-cut.
Right.
I mean, it's easy if your kid's tugging on its ear and he's unhappy and crying. But look, I mean, you could have fever, which is rare, but, you know, if you have it, you got to worry about it. Nausea, lethargy, dizziness, and then, you know, if you notice a vague decrease responsive to noise, you got to be worried about it.
Okay.
What's going to happen is if you have these symptoms and the kid isn't getting better in short order, because, you know, oftentimes there's not a lot of treatment. You can watch them if they're not too troubled by it and you just have the sense that they have it. But if they start developing fever, and
so you kind of let it run its course if it's not too severe?
You can.
Okay.
And then, but if it's getting too severe, it's not responding, then you go to the doctor, and what they'll do is they'll kind of hold them down and put, you know, this otoscope, this little probe in the ear with the light at the end of it, and they can take a look. And what they'll see from the outside is that the middle ear is bulging. And it's red. We can't see the middle ear itself, but you can see the tympanic membrane, you know, the barrier between the outer ear and the inner ear. And it can be red. They might be able to sense that there's some fluid in there called an effusion.
So you got an infection.
And then you got an infection. All right. And then again, like I said earlier, oftentimes these are viruses and you don't need to have any specific treatment. There are bacteria that are very common infectors of these, Haemophilus, pneumococcus, you know, and these are very common bacteria, some of which we get routine vaccinations for, others of which we don't have a vaccination for. And so depending on the course that your child is experiencing, the doctor will decide on which way to go. And oftentimes it is indeed prescribing antibiotics.
Watchful waiting, I like that.
That's a great term. We love that in medicine. You know, it's a great way of saying we're not going to do anything.
Well, but I mean, if you don't have to give antibiotics, that's always preferable, isn't it?
Well, you know, it is, meaning that, you know, antibiotics only work on bacteria. Right? And if it's not a bacterial infection, antibiotics will not work. And there are potential side effects to antibiotics, not only the nausea and the diarrhea, but, you know, people can have really adverse reactions. They can break out in hives. I've heard people do that.
So do watchful waiting.
And so what you do is you watchful wait. You know, what you do is you expertly do nothing and let the person recover on their own. Other ways to prevent it is to reduce exposure to sick contacts. You know, the upper respiratory infections. If your kid has an upper respiratory infection, don't send them to daycare. I know it's a hard thing to say. You know, I mean, what are you going to do? I mean, I don't ignore the difficulties of that route, but certainly that's the right thing to do. And if other people do have, you know, upper respiratory infections, you know, reduce the exposure of your child to that person. Secondhand smoke around the house is a big way that kids get upper respiratory infections. I'm not too clear of the mechanism of that, but certainly it's an irritant and can cause respiratory.
Well, you shouldn't be smoking in the house anyway.
Well, anywhere around.
And you shouldn't be smoking, period.
Around a kid particularly. Anyway. I mean, let them choose. And then hand washing. The same thing we learned with the swine flu. You know, viruses live in the environment. If you wash your hands regularly, not OCD type, obsessive compulsive, but just routine hand washing can go a long way to preventing routine infections.
There you have it. Your kids are going to get ear infections.
They will get them.
And there are ways to mitigate them. Thank you, sir. Good to see you.
You too, Joe.
Hey, you've got a question for Dr. Kumar? Shoot them over to us, amnews@fox7.com. We'd be happy to pass them along. Up next, Victor Ovalle is here, our good buddy from Austin Parks and Rec. We've got some creative ideas for your summertime. Ooh, we might mention the Trail of Lights, too, but we're not going to put him on the spot. We'll talk to him in just a minute. Don't go away.
Save 3 ways at your Austin area Mazda dealer with low APR financing plus savings rebate or no payments for 90 days available on 5 2009 Mazda models. Take a test drive today. Get a Mazda.com.